School-based occupational therapy and physical therapy, based on the ASTAS document published by the Arizona Department of Education in 2018. Occupational therapy and physical therapy processes and procedures for best practices in Arizona schools, by Johellen Strawn, co-author and presenter. Governing laws that impact service delivery of school-based occupational therapy and physical therapy. Rehabilitation Act of 1973 is a civil rights law, and it's covered under our 504 plan. Individuals with Disability Education Act 2004. Free Appropriate Public Education, FAPE. Least Restrictive Environment, LRE. Arizona Revised Statutes and Arizona Board of Education. And the Occupational Therapy and the Physical Therapy Arizona Licensing Act. IDEA. The Individuals with Disability Education Act, IDEA, is a federal education law that governs how states and public education agencies, PEAs, provide early intervention, special education, and related services to children with disabilities. It mandates that all children receive a free, appropriate public education, FAPE, in the least restrictive environment, LRE. The most recent reauthorization of the law, IDEA 2004, was intended to improve outcomes for students with disabilities by encouraging higher expectation in achievement, strengthening parental participation, and reducing paperwork requirements. Provisions require the use of scientifically based instructional practices, services, and supports that are provided in the least restrictive environment, and development and use of assistive technology. In addition, further emphasis is placed on preparing children for higher education, employment, and independent living. Title 15 of the Arizona Revised Statutes, ARS, and Arizona State Board of Education rules provide further guidance on how the IDEA is to be implemented in the state of Arizona. School-based therapy. Related services, including occupational therapy and physical therapy, are intended to enable children with disabilities to benefit from specially designed instruction in the least restrictive environment. This must differ significantly from traditional clinic or hospital-based practice. The principal focus of school-based therapy is to work with educators to identify student needs and assist in providing strategies on how to best capitalize on the student's abilities and minimize the impact of the identified disability in the educational environment. This may or may not include direct services designed to facilitate skill acquisition. Furthermore, some children may receive OT and PT services in a medical or rehabilitation setting, but if they can be adequately accommodated or demonstrate progress towards educational or functional goals without therapy, then it is not the responsibility of the PEA, Public Education Agency, to provide these services. Role of the school-based therapist. School-based therapists provide services to promote student access to the general education curriculum and progress through the special education program. School-based therapy services can be accomplished in multiple ways, including services to the child and on behalf of the child. Therapists collaborate with other members of the IEP team to assess students and assist in developing a plan for integrating services. Therapists assist school administrators in addressing issues such as access to programs and facility building modifications or new construction, curriculum development, safety and injury prevention, and technology. Scope of practice. Occupational therapy. Behavior roles and responsibilities. Following routines and schedules, organizing materials and the learning environment, manipulating classroom tools, engaging in learning activities, participating in special area classes, using alternative seating and standing options. Social skills and emotional development. interacting cooperatively with peers and adults, observing personal space, transitioning between learning activities, tolerating changes in routine, engaging in play and leisure pursuits, utilizing various kinds of school equipment safely. Activities of daily living, managing hygiene, toileting and feeding, managing personal materials and devices. Preparing for transition from high school to post-secondary living. Career exploration, disability awareness, self-advocacy, independent living skills, recreational pursuits, workplace skills. Use of assistive technology, exploring and trialing available AT options, utilizing AT to meet academic demands and functional needs, demonstrating self-advocacy in obtaining and using AT. Scope of practice, physical therapy, physical access and participation, learning routines between classes and procedures for emergency evacuation, assessing facility and playground equipment, physically navigating and participating in classroom activities and routines, participating safely at community-based instruction sites, identifying alternative modes or methods of participation. Posture and movement skills, transferring and changing positions to participate in learning activities or self-care tasks, developing gross motor skills necessary to participate in age-appropriate physical education, play with peers, and extracurricular events, utilizing alternative seating and standing options. Mobility skills, moving around the classroom and campus environment with or without an assistive device, maneuvering environmental obstacles, traveling in congested areas while keeping pace with peers, transitioning between even and uneven surfaces, adapting mobility skills to different settings and locations, including community-based instruction. Assessment and maintenance of physical health, implementing daily movement plans to promote homeostasis, monitoring skin and joint integrity, facilitating appropriate use of adaptive equipment for positioning and mobility, collaborating with nursing staff to develop healthcare plan, preparing for transition from high school to post-secondary living, career exploration, disability awareness and self-advocacy, recreational pursuit, community mobility and transportation. Assistive technology, exploring and trialing available AT options, utilizing AT to meet environmental and functional demands, obtaining and using AT independently. Determination of need for occupational therapy and physical therapy services. The results of the occupational therapy or physical therapy evaluation is reviewed at the MET. The occupational therapy and physical therapy evaluations can consist of a standardized testing and/or functional performance assessment. The need for occupational therapy and physical therapy services are determined at the IEP by the occupational therapist or physical therapist, with input from the IEP team, including parent input. The need for occupational therapy and physical therapy is not based on the student's delay in functional motor and sensory motor abilities or other domains within the scope of practice. OT and PT services are based on the lack of the student's ability to access the educational setting and/or the student needs the occupational therapy or physical therapy services to make progress towards their SDI goals. This means the student is not able to make progress toward their SDI goal without the services. What is considered? What is the need? What are the SDI goals developed at the IEP? What is the student's academic levels? Who is providing the specially designed instruction? Who else on the team can meet the need? And how to best meet the need? Is it going to be direct, supplemental support, or accommodations? Delivery of services. Supplemental support to the educational staff on behalf of the student, supplemental support to the educational staff and the student, accommodations and direct intervention supporting an SDI goal. Embedded SDI goals. Occupational therapy and physical therapy support is embedded into the student's specially designed instructional goals. Physical therapy usually support a physical development goal. Occupational therapy can support a variety of SDI goals such as math, writing, behavior, or self-care. The reason why occupational therapy and physical therapy goals are embedded is because we are a related service to the Specially Designed Instruction or SDI goals. We support the student as the person, usually the teacher, provides the SDI. This helps the student make progress toward the goal on a daily basis. When is it appropriate to dismiss occupational therapy and physical therapy services? When the data of progress or lack of progress in functional ability supports the dismissal. After listening to the IEP team, there is no longer data to support a need for the service. There is not a need for occupational therapy or physical therapy services related to their SDI, Specially Designed Instructional Goals, or access to the educational setting and program. Closing thoughts. School-based occupational therapy and physical therapy have many imposing guidelines which they must follow. School-based occupational therapy and physical therapy are a related service and support SDI goals. Their services are embedded, allowing the student to make progress daily. They can support students in general education with accommodations on a 504 plan, and they can offer universal interventions for students in the MTSS process. Occupational therapy and physical therapy services can be provided as direct, supplemental support to staff and student or accommodations. Only the occupational therapist and physical therapist can determine when to add services or dismiss services based on the Occupational Therapy and Physical Therapy Arizona Licensing Practice Act. I hope you enjoyed this presentation and have a better understanding of school-based therapy. Have a great day.